My name's James Forbes. I've just had a full left hip replacement at the Cleveland Clinic in London under a Professor Alister Hart. This is my rehab journey. 4 years ago I had a full right hip replacement due to the same bony deformity called a cam lesion. So this week I've had my left hip fully replaced. To start with, walking in the room, I used a frame like this. We're now on day 2 of my recovery. Initially, the walking process was frame, operated leg, unoperated leg. Frame, operated leg, unoperated leg. Depending on your surgery and your state of fitness, you could progress this to a more natural walking gait, which involves swinging the leg through. So bringing the frame, the operated leg, and then the unoperated leg, and just walking through in a more normal gait pattern. Now, initially you may feel a little bit unbalanced with the hips, and that's okay. You know, you're going to be under sort of pain medication, and there will be a large amount of swelling as well. So just take your time with this. Obviously, take the advice of your physios and your surgeon. Once you feel confident to progress, and that may be the same day for some people, it might be the next day, we can then look at the crutches, which will initially be crutches, operated leg, crutches, operated leg, crutches, operated leg. The progression from this would be to use a normal swinging through pattern gait, where you'll go crutches, operated leg, unoperated leg, crutches, unoperated leg. And then that should bring you into a more normal walking pattern. Just remember, the crutches there are for support. Try not to lean on them too much. Stay as upright as possible. Make sure both feet are pointing relatively in the same direction, and just try to walk through as normally as possible. When you want to turn, shuffle the feet round rather than twisting, and then walk off in that direction. Crutches, operating leg, swing the other leg through. And this should get you up and mobile. Obviously, within the first week and even maybe second week, you'll be on pain medication, which will help keep the pain levels down on your hip, which will allow you to perform your physio-based exercises. Good luck with your journey. Rehab, these are some of the standing exercises that I have been using based on having a posterior approach, you know, the implant being put in from the back. The caveats for me are probably not to bend over at the hip more than 90 degrees to pick up something heavy from the floor. There are strategies that you can use for that, such as extending the leg back and bending on your good leg to pick up the object from the floor and then sliding that leg back in. Obviously, if you've had a different surgery, an anterior approach, the advice may be a little bit different, but this is for a posterior hip replacement. So the first exercise would be to hold onto a wall or a frame and perform some heel raises, coming up and down onto those heels, working the calf muscles. Keep your posture nice and upright. You could do 3 sets of 10 to 15 of these, and you could do these really a few times a day. You could also do toe raises, lifting the front of your feet up, working the muscles on the front of the shin, the anterior tibialis muscle. Again, 3 sets of 10 to 15. We could also add in leg curls, curling your leg towards your bottom, working your hamstrings, doing both legs, 3 sets of 10 to 15. Just bend your joints as far as you comfortably can. We've also got knee flexion or hip flexion, bringing the knee towards the chest. As you do this, try and stay nice and tall, and notice that you're not shifting or leaning. Try and stay as upright as possible. So you're also working on single leg balance on the grounded leg, and do the same thing on both sides. Now, your operated leg, you may not initially be able to lift that as high, and that's okay. Just go to where you can. So they're the hip flexion and knee raises. You could also add in some mini squats, just sitting back into those hips, lightly holding on, and just go into a mild stretch for the glutes. As you go through your rehab process, you'll be able to go deeper on the way down. Now, when you face the front, just make sure your knees are in line with your toes. Just be aware that one hip's not dropping in. So mini squats is also a very good exercise. And then lastly, holding onto the wall or the frame, some leg abduction. So when you lift the leg to the side, keep your foot level with the floor, don't let the foot point up, and 3 sets of 10 to 15 reps, and then the same on the other side. Now, you may notice that you might start to tip the body over, so try to stay as straight as possible and just lift using the muscles on the side of the hip here, 10 to 15 reps. So those are some of the standing exercises. Obviously there are bed-based exercises that you will have been given some advice on in your first, in your first day at the hospital. Keep up with those if you find those are still of benefit, such as quad contractions, glute contractions, sliding the heel towards the bottom. But these are some of the standing based exercises, and hopefully this will help you on your journey to recovery.